Erectile dysfunction. Two words no one wants to hear, but millions of men deal with it every single day. It can be frustrating, embarrassing, and even scary. But here's the truth. ED is often a symptom, not a life sentence. In this video, we're breaking down the 8 real causes of erectile dysfunction. Some obvious, some surprising. And stick around because understanding the cause is the first step toward fixing it. 1. Poor blood circulation. Your ability to get and maintain an erection depends largely on one thing: blood flow. When you're aroused, your brain sends signals that cause your blood vessels to expand, allowing blood to flow into the penis. If your blood vessels are clogged, stiff, or damaged, that process doesn't work properly. This is common in men with high blood pressure, high cholesterol, atherosclerosis, hardening of the arteries, heart disease. In fact, ED is sometimes the first sign of a cardiovascular problem. That's right, your body may be warning you about a potential heart attack or stroke. So if you're experiencing ED, don't ignore it. Get your heart and arteries checked out. Second, diabetes. Diabetes is one of the most common and damaging causes of ED. High blood sugar levels over time can cause serious damage to blood vessels and nerves, especially those that affect sexual function. Men with diabetes are 2 to 3 times more likely to suffer from ED than those without it. If you're also feeling fatigue, numbness in your feet, or constant thirst, undiagnosed diabetes might be part of the issue. The good news? Managing your blood sugar through diet, exercise, and medication can dramatically improve your symptoms. 3. Low testosterone. Testosterone is often thought of as the sex hormone, but its role is much bigger than that. It affects your mood, muscle mass, bone health, and yes, your sexual drive and function. Low testosterone, also called low T, can lead to decreased libido, weaker erections, mood swings, fatigue. But it's not just testosterone. Imbalances in thyroid hormones, prolactin, or even cortisol, the stress hormone, can disrupt your sexual health. A simple blood test can identify hormonal imbalances, and treatment can include lifestyle changes, supplements, or medically supervised hormone therapy. 4. Stress, anxiety, and mental health issues. Your brain is just as important as your body when it comes to sexual function. Mental health issues like stress, anxiety, depression, or relationship tension can block the brain's signals that start the erection process. This is especially true in younger men, where psychological causes are often more common than physical ones. One bad experience can create performance anxiety, which then becomes a cycle: fear, failure, frustration, repeat. Breaking that cycle might require therapy, meditation, stress reduction, or couples counseling, but it's fixable. 5. Medications and substance use. What you take for other health conditions might be affecting your performance. Common medications linked to ED include antidepressants, especially SSRIs, blood pressure medications like beta blockers, sedatives, antihistamines, chemotherapy drugs, and let's not overlook alcohol, smoking, and recreational drugs. These substances interfere with brain signals, blood circulation, and hormone levels. If you've recently started a new medication and noticed changes, talk to your doctor about adjusting the dose or trying an alternative. 6. Obesity and lack of physical activity. Carrying extra weight, especially around your belly, can wreak havoc on your sexual health. Obesity is linked to high blood pressure, diabetes, low testosterone, poor circulation. It also lowers self-confidence and increases the likelihood of sleep apnea, all factors that contribute to ED. On the flip side, even modest weight loss and regular exercise can lead to major improvements. Try walking 30 minutes a day, eating whole foods, and cutting back on sugar. Your body and your performance will thank you. 7. Sleep disorders, especially sleep apnea. Sleep isn't just about rest. It's when your body balances hormones, repairs tissues, and resets itself. Men who don't sleep well, especially those with sleep apnea, have higher rates of ED. Poor sleep reduces testosterone levels and increases stress hormones like cortisol, which throw everything off balance. If you snore loudly, wake up gasping, or feel tired even after a full night's sleep, it may be time for a sleep study. Getting quality sleep can lead to better hormone regulation and better intimacy. 8. Neurological conditions and nerve damage. Erections rely on nerve signals from the brain to the penis. If anything interrupts those signals, ED can occur. Neurological conditions that may cause this include Parkinson's disease, multiple sclerosis, stroke, Alzheimer's disease, spinal cord injuries, even past surgeries, like prostate surgery, can damage nerves temporarily or permanently. In these cases, your doctor may recommend medications, devices, or therapy tailored to your condition. Erectile dysfunction isn't just about what happens in the bedroom. It's often a red flag about what's happening in the rest of your body. From blood pressure to mental health, hormones to habits, the causes are many, but so are the solutions. The key is to identify the root cause and then take action. Whether that's through lifestyle changes, medication, therapy, or simply asking for help. If you found this video helpful, give it a thumbs up and share it with someone who might benefit from the information. And don't forget to hit subscribe for more honest, science-based health content. Remember, taking care of your health isn't just about living longer. It's about living better. And that includes your confidence, your relationships, and your overall quality of life.